Hatvet PHARMA welcomes you to the ocean of practical knowledge about small animal practice. That is Hatvet's YouTube channel.
Dr. Chandrashekhar sir is a renowned clinician having a clinical experience of more than 20 years in small animal practice. He has pursued a postgraduate degree and a doctorate in veterinary clinical medicine. Currently serving as a professor in the Department of Veterinary Clinical Medicine at MVC Chennai, he specializes in veterinary medical oncology and small animal internal medicine. Hatvet family extends a heartfelt gratitude to Dr. Chandrashekhar sir for sharing insightful content with our fellow veterinarians. Thank you, sir.
Dear participants, online viewers, today's presentations I would like to talk to you about gastric dilatations and volvulus. There are two topics, one is dilatations and one is volvulus. And the point which I am going to discuss is mainly observed in giant breed dogs, especially breeding, they prone to get the problems. And then regarding gradient predispositions, they identify the genetic maybe the factor behind these problems. There are few factors they declared, like overeating, or when they eat and a lot of gas consuming along with the food. That is also another problem wherein animal can develop GD or GDV. Sometimes the gibbal food is also one of the reasons. And after over intaking, going for galloping exercise is also another predisposing factors. To get the GDV problems. So mainly the message about the GD and the volvulus, the pet parents should be educated. Those who are having bigger dog, they should be educated about the bigger dog, giant breed dog ailment of GD or V volvulus, so that they can bring their pet on time, and we will be able to do our service on time. That is the message. There are two things as a veterinarian we can do. If it is a gastric dilatation, just introducing the stomach tube, you can relieve the gas, you can save the animal. If it is a V, you need to do a gastric decompression by using 16 or 18 gauge needle. Just palpate the area or identify where exactly the tympanic sound you are able to appreciate, or the distant area you can appreciate. Then introduce the needle, and then you can release the gas. By releasing the gas, we call it as decompression. When you do that, a lot of pressure on the all other internal organs can be minimized. In example, my hand is the distant stomach. Imagine above that is the head, below that is leg. Above area, you have a diaphragm. When the diaphragm compresses the heart, so it will create less amount of perfusion of the blood, purified blood to the vital organs. Especially less amount of blood goes to the lung purifications. Similarly, less amount of blood goes for purified blood goes for all other vital organs. For example, you take liver, you take kidney, and you also take gastrointestinal region, all other internal organs. So that will cause less amount of perfusion. Example, if it is less amount of blood goes to the kidney, it will cause anuria. Less amount of blood goes to the liver, it will cause hepatic failure. See, similarly, gastrointestinal mucosa, less amount of blood goes, it causes a lot of degenerative changes in the gastrointestinal mucosa. Ultimately, the shutdown of the organ encounter. The shutdown of the organ, once you identify the problems, and it will result in a shock, result in hypovolemic shock. The hypovolemic shock, we all know that how it has to be addressed on time. So hypovolemic shock, the most important thing is we need to administer the fluid on time through intravenous route, through cephalic or saphenous vein. You can administer the fluid. Once you administer the fluid, the stabilization you can make it. Apart from this, the most important thing is you need to do a gastric decompression. Just to palpate the distant area, introduce and release the gas. That will do a lot of relief to the animal. And all these pressure on the organ can be minimized. Similarly, the distant of the stomach, that will cause pressure on the posterior vena cava, and then in turn it will cause less amount of blood to the heart. Less amount of blood to the heart from the right atrium, it goes to the less amount of blood to the right ventricle. From the right ventricle through pulmonary artery, less amount of blood goes to the lung for purification. There again, through pulmonary vein, less amount of blood coming to the left ventricle, and the aorta also send less amount of blood. So, because of the pressure, it will cause hypovolemic condition, all other organs. This is one aspect. It is only dilatation, and just by gastric intubation or gastric compression, you can relieve the problem. And then imagine this distant of stomach, it gets twisted. From the pyloric region is the dependent part. It can goes upward. It will encircle the stomach. During the process, the adjacent organ is the spleen. Spleen undergoes, twisting, and less amount of blood to the spleen. It will cause it loses the vital activity. And there will be the trauma to the spleen. It causes more amount of blood coming to the abdominal organ. That is hemorrhage into the abdominal organ. That results in hypovolemic shock. So this is a nutshell information about the GDV. And then when you do hematological diagnosis, when you do with blood testing, you will identify the loss of hemoglobin, PCV, RBC that indicating anemia. On those cases, we have to give a blood. Severe dehydration, we need to administer the fluid. Another important observations in the blood, there are, if you have a blood gas analysis, the lactate level also getting elevated, and that has to be addressed. And there are a lot of electrolyte changes, potassium changes, like hyperkalemia is an emergency, hypokalemia is a major problem in case of GDV. In my practice, what I do if I am getting the cases of GDV, and initially what I do, I will administer the lignocaine. Once I keep that dog on the table, first of all, I will sedate them. Once I sedate, after that, I'll put him on the lignocaine, so that the VPC episode we can minimize, while doing the surgery or after the surgery, the VPC problem we can control. That's the way we do. There are a lot of publication also available. You can Google it, you can identify the problem. And then during the process, a lot of electrolyte changes. The most important thing is the potassium changes. The potassium we have to administer based on the availability in the serum. And surgery-wise, you need to do a gastrotomy and relieve all the gas. You can do a gastropexy, right abdominal wall, they fix it. There are a lot of other techniques they follow, to position the stomach. Some other, what they do, they keep the indwelling catheter into the stomach. They inflate it, and then they close it, and then they leave it with the patient for a couple of days. After a couple of days, once the healing they observe, and then they'll deflate it and remove the indwelling catheter, so that the recurrence of bloat can be minimized. And majority of the medicinal management of GDV cases, there will be a recurrence. So better, if you identify the case of GDV, better do a surgery so that you can avoid the recurrence. These are all some of the common management. There are certain PowerPoint slides which you prepared. I would like to tell you one by one. It contains detailed information. I want to share one by one. Introduction. When the stomach rotates along its axis and dilate with the gas and fluid, you will encounter the problem of GDV. What are normally present complaints typically include non-productive retching, restlessness, excessive salivation, swallowing, and abdominal distension. These are all the common complaints the owner used to tell. This is most commonly seen in large breed dog. Already I told you. GDV can occur in any breed, any species of animal. There are Wild animal GDV also they reported. There are few publications which I have seen. So it can be with any species. It can be with any animal. Majority, a lot of publications about supporting the gradient prone to problems. Saint Bernard prone to get the problem. Bernard prone to get the problem. In my practice, I observed the GDV problem in cases of encountered in German Shepherd. The first breed which I have seen, couple of cases with German Shepherd. First breed is Great Dane, next German Shepherd. Then we observed in Doberman, and we also observed a few percentage of the Boxer breed also. So what are the our management? What is available in the world literature? Everything we'll share you one by one. This also called as bloat. See, imagine that if you are getting cases of GDV or V, it is like how you manage the bloat problem in cattle. Similarly, you have to manage it. Suppose the free gas bloat in a cattle, what you do? Just you procurize the distance as a woman, you release the gas. Or you can also intubate the cattle, you release the gas. These are the two methods normally.
Hatvet Pharma presents Rantiraj, ranitidine syrup and tablets. Ideal antacid with the strength as per dose requirement of our pet clients. Rantiraj is available in the following formats: ranitidine hydrochloride tablets, Rantiraj tablets; ranitidine syrup, Rantiraj syrup. For placing order, contact our sales team or WhatsApp 98372 53817 or visit www.hatvet.com.
We follow release the gas from the cattle woman. So here what will happen now in case of GD, gastric dilatation, you just puncture and release the gas, or you can intubate the animal. First you have to sedate. After sedation, you have to put a ET tube so that while intubation the aspiration can be minimized. Then you can intubate and relieve all the gas. So that's the way you have to do it. And there are a few definitions. One is the dilations. It is called act of stretching a cavity or orifice. Another one, dilatations, condition in which an organ or structure is stretched behind its normal dimension. That is simple dilatations. Refers to a stomach that is engorged with hair or froth, but not malpositions. This is very easy. Simple dilatation, you put a needle and release the gas. Gastric dilatation and volvulus, enlargement of the stomach associated with the rotation on its mesenteric axis. Imagine this is the distance of the stomach, it's only a dilatation, gastric dilatation. If it is a volvulus, there is a rotation of the on its mesenteric axis. That means there will be a stasis of food material in the stomach. It's not going below. It's not going to the small intestine. Animal even not able to erect. So a lot of carbon dioxide, a lot of amines getting accumulated in the stomach, and then it goes to the systemic circulations, and this material cause toxicity in the body, and animal going to shock, and we miss the patients at the earliest. You can see in the pictures, you can see the esophagus, you can see the stomach. So what we are talking, the stomach getting twisted, the adjacent organ with the spleen. So when it is twisted, that there is a damage to the spleen, trauma to the spleen. You will get blood accumulation in the abdomen. We call it as hemoabdomen. And then the dependent part, the pylorus. The pylorus, occupy the topmost area. Here you can see this is the fundus body and the pylorus, and the pylorus going up. And when it is going up, it get twisted. Once it twisted, as the time advances twisted, it becomes an emergency. It has to be addressed at the earliest. This already I told you, there are several etiological factors which causes GDV in dogs. One is sometimes lean body conditions, increasing age, And then there are a few occasions, for this large drop in environmental temperature over a short period of time is also another predisposing factor. Feeding a single large meal is also another problems. And the overeating, this already I told you. A small gibble size, this already I told you. Then many places, they sell feeding bowls in an elevated place. Elevated feeding bowl is also another predisposing factor wherein the animal prone to develop GD or V. Then exercise, postprandial exercise, anesthesia, aerophagia, nothing that air getting consumed by the animal, that will also prone to develop GDV problems. This is the thing. So the small size kibble, when the dog, gulp in a speedy manner, they're prone to develop these problems. And then this is the elevated bowel, and it's also available in most of the pet shop. And when the animal, eagerly coming and consume the food, they're prone to develop this problem. And you can see the normal stomach, it will be within the rib cage. When it is distant and after 13th rib, you can identify the palpate and then identify the distension. And you can see, the animal is also dull and, the anxious expressions, distant the stomach, we can see. Anteriorly compressions, it causes, reduces the activity of the heart and reduces the activity of the lung. Posteriorly, it causes compression on the liver and also on the kidney, and the main important organ is the spleen. Some of the surgeons, what they accomplish, as soon as you do laparotomy, you stabilize the damages on the spleen so that you can preserve the animal as early as possible. If there is a delay in the preserving the spleen damage, a lot of blood bleeding and a lot of blood loss, so that you may miss the patient due to hypovolemic shock due to blood loss. Pathogenesis, the mechanism that initiates a GDV event, has not been definitely elucidated. So no one say this is the exact reason wherein animal develop GDV. There are few, be it gastric rotation followed by dilatations, or dilatation followed by rotations. These are all the hypotheses they derived. And during the process of rotation or dilatations, the bacterial fermentation from either ingested food or duodenal reflex, producing a carbon dioxide and hydrogen gases. This normally it has to be eliminated during the process of consumption of food. And when this carbon dioxide hydrogen gas is accumulating, so it causes a result in stomach dilate. It may stretch its attachment or rotate in either clockwise or counterclockwise, preventing the expulsion of the contents. This is the major predisposing factor. The important bad element is the carbon dioxide and hydrogen gases. If they keep accumulating in the stomach, you get all these issues. There are gastric motility disorders. Because of this huge distension resultant gastric motility disorders, you can see in the images, normally position in the stomach, esophagus begin to twist and the pylorus begin to point upwards. You see in the image, you can see here in the pylorus, this is the esophagus, and when the esophagus begin twist, when there is twisting, the pylorus begin going up. Normally the pylorus should be here, esophagus here, and when the esophagus twisted, the pylorus going up. The stomach twisted, next is the stomach twisted, and the pylorus move to the opposite side. When the stomach also twisted, the pylorus going to the opposite side. Comparing here and also here. Air is trapped in the stomach and the stomach distant. So there is a rotation here, and then pylorus also going and going upward position. So the lot of air getting trapped in the stomach. Another image, in a nearly upside down and backward position, the blood vessels in the stomachs are compressed. There are a lot of blood vessels in the stomach are compressed. Without circulating, the stomach tissue discolor and dies, because you can see there is a rotation on the esophagus, And you can also see the pylorus, how it is completely folding the available small stomach region. There is a twisting on the top, and the pylorus also encircling the stomach, and then the blood supply to the stomach getting affected, and there will be a sloughing of the healthy tissue, and then there are a lot of devitalization on the healthy stomach regions. And then understand the symptom before it is too late. You just see in the diagram the pylorus in the bottom is going up, encircling the stomach, and then complete it occupying the complete stomach region. So the situation is like this. Healthy animal suddenly it will become distended stomach. It will become flat, and there will be a rapid breathing. There will be a tachycardia, a less amount of blood supply to the vital organ, result in anuria and other things. You see the healthy animal is comfortable, it's able to breathe comfortably. Bloated animal, there's a distension cause pressure on the anterior part and also the abdominal region. Animal become in a discomfort positions. And then when it is twisted, it's become very bad. There is a dyspneic difficulty in breathing. There is also tachycardia, increased heart rate, and all the vitals, it loses their functions. This is an important chart. I would like to share it to you. And then what it does in this image, you see a gastric dilatation. If you get a gastric dilatation, Volvulus, I will go one by one. There will be a thoracic and diaphragmatic impingement, and that will reduction in tidal volume. And then there will be a ventilation perfusion mismatch. Normally, the mismatch should not be there. If there is a mismatch of ventilations because of the gastric dilatation of valvulus, and the animal have a difficulty in breathing. So another important pathway, and already I told you, there is a too much distension, rotation of the stomach, and the pylorus in the dependent part going up, and the usually is also twisted, and this results in enlargement of the stomach and causes reduced perfusion to the caudal vena cava, reduced perfusion to the portal vein, and then this result in hepatic endotoxin, the decreased clearance of hepatic endotoxin clearance. And because of this pathway, there is a decreased venous return, and there is a decreased cardiac output. This already I told you beginning of my presentations. And the decreased arterial blood pressures, and then decreased tissue perfusion, and then decreased splanchnic hypoperfusions, result in the reperfusion injury. This is one pathway. Because of decreased tissue perfusion, it causes myocardial injury. Because of this, probably we get the BPC bizarre QRS complex on the ECG, and since it's having a myocardial injury, and because of this myocardial injury, you will get arrhythmia, the ventricular premature complex on the ECG papers. Okay, this is the one pathway. So another pathway, there is a less amount of blood supply to the distended stomach, that we call as gastric ischemia, and result in gastritis and gastric mucosal necrosis. This already I told you beginning of my presentations, and this in turn result in fluid loss, and again it result in absorption of bacteria and endotoxins. I told you about carbon dioxides and some of the waste materials, and result in septic endotoxic shock. This already I told you. Because of gastritis and gastric mucosal necrosis, there will be a blood loss, anemia also is another pathway. And this episode will also result in protein loss, hypoproteinemia. So anemia, hypoproteinemia, myocardial injury, all these we can encode in case of gastric dilatation. Another pathway, gastric ischemia results in reperfusion injury. So another pathway. Then another thing, gastric necrosis, it's also result in perforation of the stomach, result in peritonitis. It's a quite serious issue. Then another pathway.
Hatvet Pharma presents PantoHat, pantoprazole injection and tablets. A powerful tool to prevent and treat gastric ulcers and esophagitis. PantoHat is available in the following formats: pantoprazole sodium tablets, PantoHat 40 tablets, pantoprazole for injection, PantoHat IV injection. For placing order, contact our sales team or WhatsApp 98372 53817 or visit www.hatvet.com.
Intestinal ileus it will result in there is a motility disorders, and then it then result in gastric atony. Stomach loses its motility functions, and there will be a fluid secretion, electrolyte imbalance you can include because of this episode. You see, all other organs they loses their functions, and there will be a ventilation, perfusion, lymph mass. When you come to the caudal vena cava and reduce the caudal vena cava, reduce the portal vein and reduce the vena return, reduce the arterial pressure, and the result is hypertension injury. On the heart, it's called myocardial injury and the myocardial dysfunction. You will get the VPC on the ECG papers. Because it's so much distension on the stomach, it reduces perfusion to the stomach and result in gastritis and gastric mucosal necrosis, result in fluid loss. And in turn, result in absorption of bacteria and endotoxins, result in septic endotoxic shock. And animal with this pathway result in blood loss, result in anemia. So another pathway, protein loss, result in hypoproteinemia. There is a gastric necrosis, result in perforation peritonitis, and it also result in intestinal ileus and gastric atony and result in the electrolyte imbalance. This is the one I told you. Part of potassium deficiency you need to administer. And then peritonitis, there is some this has to be rectified. There is a perforation that has to be corrected. If we don't correct it, it will result in septic shock. There is a protein loss. This has to be corrected by supplementing the protein, in the injectable form. Anemia, you need to give the blood. Arrhythmia, VPC, you have to give the lidocaine. And then you need to correct the blood flow. Reduce the blood flow, that has to be corrected. And once you corrected that, the pressure on the thorax and diaphragm getting minimized. There won't be any problem in the tidal volume, and there won't be any problem of ventilation perfusion dispatch. And then when you correct with all these problems, the animal will have a good motility of the stomach, and also in the intestine they'll have a good normal life. So that chart you ought to remember. So another, you can see the intestinal stomach. Normally the pylorus will be in the bottom, and then because it twisted, it goes up. The stomach it is going up, and then the duodenum is here, and you can see the VDU. The pylorus are coming this side, and the distal stomach is occupying the entire abdominal region. And when you do on scanning you cannot make out anything. Maybe you can make out the spleen. The spleen will be malposition because of the too much distension. It causes rupture of the splenic parenchyma. There will be a blood loss, and that you can appreciate with the ultrasound. And you will get a starry sky appearance on the spleen. These are all the observations which you can make out. And so ultrasound is not a good potential tool in case of GDV, but potential tool to detect GDV or GDV in the X-ray. So distant to the stomach with the gas, it will be black in nature here, but there the gas will be hyperopic with ultrasound, and the fluid here white in nature with the X-ray. Their fluid, it will be black. These two terminology, practitioners should remember when you look at the ultrasound and X-ray. So that you can identify their problem by looking at these two classifications. This is a small information, but it's a major information saving the life of the animal. You imagine this gas you are relieving with the gastrosynthesis. See, all the organ it will come to the normal position. Here is a too much distension. There is a compression of the diaphragm. The lung capacity getting reduced. That is the reason it results in ventilation perfusion mismatch. And here you have the heart. Heart, it cannot function normally, and it has to beat more. They call it as tachycardia. And then it sends less amount of the purified blood for circulation. Even it's a compression on the liver. It causes less amount of blood sending into the heart, and since too much pressure, spleen, malposition, too much pressure on the kidney, because less amount of the blood supply to the kidney result in anorexia. There's so much alteration in the intestinal, alteration in the abdominal organ, and you can also see the motility of the intestine. There is no space here. How the intestine can function like a normal intestine. These are all some of the observation. Just by taking a plain X-ray, you can make out all these observations. There is a GD, you can a small dilatation you can make out very easily. The system affected already. I told you in my presentations. In the pathophysiology itself. But even then, there are system affected one by one. We want to explain to you. First, the action on the cardiovascular. Compression of the caudal vena cava decreases resistance of blood to right side of heart, causing decreased stroke volume, decreased cardiac work, result in hypotension. This already we told you. And this result in myocardial arrhythmia, dysarrhythmias, hypovolemic shock, hypoxemia. So all those changes you can observe on the cardiovascular system. Gastric system carrying up gastric blood vessels, reduce the gastric blood flow, ischemia you can encounter. Increase the intraperineal pressure and decrease the cardiac output, decrease the splanchnic blood flow you can encounter. On the respiratory system, aspiration of swallowed saliva, upper airway obstruction from the regurgitations, aspiration pneumonia, all those things you can encounter. And then decrease the thoracic capacity from the gastric distension. This already told you with the X-ray itself. And then diaphragmatic compression, this also already we told you. There will be a hypoventilation, less amount of inhalation and exhalation of the intake of oxygen and releasing of carbon dioxide getting prevented at the alveoli level. And because of too much distance from the stomach, result in hypoventilation, result in hypoxia. Differential diagnosis, you need to differentiate the gastric dilatation and without the valvulus. You need to combine with whether the problem is food bloat, whether the animal is having a splenic torsion by taking in, we do an ultrasound, the normal spleen, they have a homogeneous parenchyma. In case of splenic torsion, they say starry sky appearance should be there. You will not able to see the homogeneous parenchyma. Intestinal valvulus, the posting you can appreciate with the ultrasound. And then peritonitis, there is a inflammation of the peritoneum. You can appreciate with the ultrasound or the fluid you are collecting with the peritoneal region. You see more amount of WBC curve. Megaesophagus, megaesophagus also the symptoms for the GDV is vague, like vomiting, retching, restlessness. And this will also be there in megaesophagus. When you take a plain X-ray, the distended esophagus you can appreciate. Infectious tracheobronchitis, you will have to collect the materials with the bronchiolar larvae, and then the presence of infection path you can make out. And with the plain X-ray, carefully observing the changes on the tracheal and the bronchial region, you can make out. If it is a gastric dilatations, you will be only the distended stomach will be there. If it is a valvulus, the bubble double appearance will be there. So that's one thing. And then food bloat, you need to correlate with the food intake. Whether the after your intake of the food, the episode happened with the careful history taking, we can make out. And then with the ultrasound and then with the X-ray also, the presence of food material you can appreciate with the careful evaluations. That's why you have to differentiate all these problems. This will also mimic the the present emergencies. And you can so physical examinations, since the animal causing compression of the spleen, there will be a rupture and then bleeding, that will call the pale gum. And then because of compression on the abdominal region and also thoracic region, there will be hypersalivation, excessive drooling will be there. The animal trying to vomit, but nothing comes out. This is also another important. And the distended stomach, with a careful palpation, if you have too much distension, you can appreciate a tympanic sound. And because of distension, it's called severe distress. And there will be a pawing and restlessness. You can appreciate, animal affected with this GDV problem. So all these things are vague signs. Pale mucous membrane is there in thousands of diseases. Hypersalivation is there in many diseases. And then the trying to vomit is there in many diseases. And then distress are there in many diseases. Restlessness you can encounter in all diseases. Only if, symptoms, the distended stomach is a key point, and that causes all these signs. So with a careful examination, careful history taking, it's it will give a clue for the veterinarian to identify the problem of GDV. Then gastric tympani is discovered on initial examination. Occasionally, the caudal thoracic grip prevent the palpation of the distended stomach. Sometimes, normally, within the 13th rib, too much distension on the abdominal region can palpate, but sometimes it's within the thoracic rib is quite difficult. Prior to obtaining radiation, treatment of abdominal shock is very, very important. Administration of pain medication. I told you hypovolemic shock through cephalic or saphenous one, you need to administer the fluid. Then pain control is very, very important. My preference of pain drug is the butorphanol. I normally use 0.2 mg per kg per day. Gastric and the gastric compression are indicated. Gastric compression is normally, before I refer the cases to the surgeon, whether it's a D or a B, dilatation or valvulus, normally I see the distal area, apply some antiseptic, then infiltrate some liquid again, then immediately I introduce the needle. And then I will just squeeze. The most important thing is when there is a distance or somewhere, I put the needle image. I will give a compression with the available space, both that side and this side. What it does now, more amount of gas getting released from the poke the needle side. So through the needle, the gas will come out. That itself will give a lot of relief to the patients. The patient will become normal. So that is the important message. I've gone through a lot of these. Lots of literature, lot of research finding. What they observe, gastric decompression is the key point in managing the cases of GD or B. Then after that, doing surgery or positioning, all those things we need to do it later. In the initial resuscitation, flow by oxygen should be provided. The most important thing is flow by oxygen. In that itself, the animal get a lot of oxygen, so that you can avoid the hypoxic condition in the tissue levels. IV access attend and the country is to monitor. You have to attend as soon as possible. I told you, there is the pathology, pathogenesis. I told you there is a myocardial injury, though, so that can be identified with the help of ECG monitoring. Not only that, any tachycardia, so any arrhythmias, so all those things you can, even hyperkalemia, peak D wave, all those things we can appreciate. Ventricular tachyarrhythmia are common in case of GDV patient, and continuous ECG monitoring should be obtained throughout the pre-operative, peri-operative, and the post-operative period. So all the during, after, all these time ECG monitoring is very, very important while managing the cases of GDV. Fluid resuscitations, they say hydroxyethyl starch you can use because the molecular weight of the hydroxyethyl is 2 lakhs. It can be in the blood vessel for longer time. You can avoid the hypovolemic shock for these patients. The hemoglobin-based carriers also can be used, to prevent the problem of anemia. Hypertonic salines, this also can be used to avoid the problem of shock. So hypertonic salines to achieve a resuscitation endpoint and potentially improve the outcomes. Analgesic, I already told you, idomorphine, morphine, oxymorphine, pantolin is commonly indicated yearly in the period of resuscitation period. So all these drugs, commonly used in the management of GDV patients to control the pain. Initiation of lidocaine. So lidocaine, how much you use in case of ventricular premature complex? 2 mg per kg body weight bolus and 0.05 mg per kg per minute as a continuous rate of infusions. At the time of fluid resuscitation initiated, may reduce the risk of cardiac dysarrhythmias and acute kidney injury. This was I want to tell you. So normally what I do, 2 mg per kg body weight before the surgery itself, I put in my cases of the GDV, while we are operating. Before the operation we start, and then after that 0.05 mg per kg CRI we follow. But this recommendation also you can follow. Thereby you can avoid the problem of myocardial injury. So another thing, gastric decompression can be performed.
Hatvet Pharma presents Rantiraj, ranitidine syrup and tablets. Ideal antacid with the strength as per dose requirement of our pet clients. Rantiraj is available in the following formats: ranitidine hydrochloride tablets, Rantiraj tablets, ranitidine syrup, Rantiraj syrup. For placing order, contact our sales team or WhatsApp 98372 53817 or visit www.hatvet.com.
Spontaneous placement of large bore over the needle catheter into stomach bronchization or orogastric intubations. This already I told you. So where exactly the distant stomach you palpate, identify. If you are worried about the spleen function, do a quick ultrasound. You identify the spleen area, then mark the distant stomach, shave it, apply some antiseptic, put 2% lidocaine on the poking side, then introduce the 6 gauge needle to relieve the gas. Or sedate the patients if the animal is awake. Then you can go for orogastric intubation. You pre-measure the length from nasal cavity up to the 13th rib is the area wherein the stomach getting located. And what you need to do is you need to apply some lubricant jelly on the orogastric tube. And normally I'll also spray lidocaine on the caudal part of the oral cavity, especially on the epiglottis side. What I do now, first of all, I sedate the patient. After sedating, I intubate the patient. Selecting the ET tube depends upon the nasal septum size. This is nasal septum now. This will be approximately the size of the trachea. I will measure. I will take the ET tube. I will place it here and check. And another method, I can also palpate with my finger. I can approximate measure the size of the trachea. Then I will select the ET tube. I will also spray the lidocaine spray on the ET tube. Before that, I check the inflation on the tip, inflation cup. I check whether it's functional or not. Then if it is functional, it should not be too much distant also. Enough amount of hair you have to infuse. Just touch and then see. Then deflate it. Then introduce it to the trachea and then inflate it, fix it. Then you put a orogastric tube. Then if it is a problem of dilatation, the gas can be released. And then you need to put a lot of saline, bring the animal very closer to the table. So all the saline, through gravitation, it will come out very easily. Or mild small suction apparatus can be used to suck out all the materials so that, the emergency problem can be rectified. All the toxic material, whatever is present in the stomach, can be minimized. The animal will have a good quality of life by sending the good blood to the various parts of the body. The site of progression should be chosen as an area of palpable gastric. This was I told you. Just palpate the distant area, then introduce the needle and relieve the gas. Caudal to the rib. This is more commonly along the right side, but can occur on the left also. Ultrasonography can be used to identify the location of the spleen when selecting the site. The idea of telling about the ultrasonography, if you are accidentally poking the spleen, already especially the highlights where the splenic artery and vein is going, so it will be a lot of bleeding. So to avoid that, they advise locate the spleen, then do a puncturing on the stomach, not on the spleen. That's a message. The area is clipped free of hair and prepared in aseptic manner. The catheter placement is performed using aseptic. This already I told you many times. In the most dark, 14 gauge, 16 gauge size catheter is introduced. Gas and fluid are expelled through the catheter as a result of gastric pressure. Gentle compression of the abdominal wall opposite the side of the catheter may aid in maximizing decompression. The gentle compressions will also help in maximize the decompression. The 16 gauge needle or 14 gauge needle, they have a small bore size. So you will not expect more of the gas coming inside. So what they advise, you give a compression on both the side and also this side. So the gentle pressure, it will help, ask someone to hold the needle so that, you give a pressure, that will release all the gas. So all the malpositioned organ come back to normal position. So all the organs get a better blood supply. So they regain the normal function at the earliest. It is an important procedure managing the case of GDV or P. Then orogastric intubation require manual restraint and the sedation of the alert patients is very, very important. A smooth, flexible tube is lubricated and gently passed into the oropharynx and esophagus. Orogastric intubation carries the risk of aspiration, esophageal trauma, and the gastric puncture. To avoid aspiration, put a ET tube, then do it. No, then there won't be any problem of aspirations. Precautions: non-sterile antibiotics should not be used in patients with GDV because of its adverse effect and key factor pre-operative management. Another important message is non-sterile anti-inflammatory drugs. It will aggravate the problem of ulcer. It will delay the wound healing. Already spleen damage, kidney damage, liver damage, heart damage, lung damage. During the process, gastrointestinal tracts are damaged. During the process, if you use non-sterile anti-inflammatory drug, it will aggravate the problem of gastric ulcers, and it won't heal the wound. So avoid using the non-sterile anti-inflammatory drug in case of GDV. Then pre-operative management, animals should be given with IV fluid antibiotics. So pre-operatively, better to give IV fluid because hypovolemic shock. This can be reversed. Because of enlarged stomach, it may be difficult for an animal to ventilate during anesthesia. So because of distended stomach, you will have difficulty, to ventilate. So ECG should be monitored to detect the cardiac arrhythmias and treated with lidocaine. 9 milligram is taken and half should be given initially before surgery. That's what I told in the beginning. Then pre-operative drugs. If an animal has been decompressed and stable without the cardiac arrhythmias, hydromorphine 0.1 to 0.5 mg per kg IV IM in dog and the diazepam 0.2 mg per kg IV can be given and induced with ethambutol 0.1 to 1.5 mg per kg IV or propofol can be used as a pre-operative measure. If animal is in depressed state, no pre-medication is needed. So only induction with ketamine or ethambutol can be done. Ethambutol, good choice of induction, maintain cardiac output and not arrhythmogenic. Nitrous oxide should not be used in dog with the GDV. This is another important information because nitrous oxide is mostly available in the gas anesthesia machine. If you use that, that will be the end of the animals. Proceeding, dorsal recumbency, midline, abdominal incision you can make, extend from mid-thorax to PBC, the incision area. Goal of surgical treatment, inspect the stomach and spleen and remove the damaged and necrotic tissue. The first advice they were telling, inspect the spleen and the stomach, remove the necrotic tissue. Decompress and correct any malposition. So adhere the stomach to the body wall to prevent the subsequent malposition. Radiograph, a standard right lateral cranial abdominal radiograph is the most diagnostic. Classical radiograph evidence of GDV include the presence of a gas or fluid distended stomach with the displacement of the pylorus, giving the stomach as a double bubble appearance or papaya. This was, I told you, double bubble appearance. So there will be a air-filled small area, and below that the bigger area will be there. That's what they're telling us, the double bubble appearance of papaya. On a dorsal view, the pylorus appears as gas-filled structure to the left of the midline with the G. In dorsal view, you can see the pylorus and duodenum and the distended stomach. And then when it become twisted, you can see the pylorus here, the distended stomach here. Hematology and biochemistry, blood sample for an emergency, laboratory database are collected, packed cell volume, total protein, venous blood gas, electrolyte panel, glucose and lactose are evaluated. So the PCD and the total proteins, you can estimate the ready-made equipment. Then we have a blood gas machines. We can collect the blood from the just palpate the or any cephalic or subcutaneous vein. You collect the blood. And what is that? Before collecting, you need to take a heparinized heparin in the insulin syringe. Then you collect the required quantity of blood. There are a set of instructions will come to the blood gas machines. You just note the blood and then it will read and automatically you will get the blood gas readings. And then In the blood gas also, you will get the electrolyte panel also. You will also get the glucose value. You will also get the lactate levels. So my suggestion, practitioner, better you keep the bedside blood gas machines, and this will give you the correct status about the patients. It will help you to give the better line of treatment to the animal, and you can tell the better prognosis to the pet parents. So it's a bedside diagnostic tool. You must keep it. It costs about Indian money 3 to 4 lakhs, but it is worth it. Every day we use in our practice. That will give a meaningful result. It will help us to determine. Suppose example, even we get the PCV, and then it will help us to determine, whether the animal is anemic, whether the animal is dehydrated. Anemia means we will give blood. If it's a dehydration, we give fluid. And then electrolyte panel potassium less, will administer potassium. Potassium high, that means we'll give a 20% dextrose, calcium gluconate, insulin, sodium bicarbonate, and other drug. And then glucose, if it's hypoglycemia, the blood glucose coming less than 70 milligram, we'll administer the glucose 20% dextrose, 1 ml every kilo body weight IV. Then lactate level is a good prognostic indicator, and it will help us to tell the prognosis on time to the pet parents. So thereby, within all this decision, you can do it within 2-3 minutes. Then we can start the treatment with your team. That's why it will help. Then hemorrhage is evidenced by decreased PCV and total protein. Metabolic acidosis carried by hyperlactalemia is common. The metabolic, even the bicarbonate level also you can estimate in the ABG machine. And then the bicarbonate less than 20 millicoulomb per liter. It's in the animal, the metabolic acidosis. It will help us to design to give the even sodium bicarbonate on time. An initial plasma lactate level less than 4 millimole per liter, and or more than 40% reduction in the plasma lactate level following fluid restriction are associated with the increased survival. So if the plasma lactate level less than 4 millimole, and then by fluid restriction, there will be a 40% reduction in plasma lactate level. If you give the fluid itself, there will be a reduction of plasma lactate level associated with increase in survival. So how is this possible? When you have a APG machine, you can collect the blood on time. You can estimate the lactate level. If the lactate level is more, you have to administer the fluid on time. This is one method. So the lactate level more than 60 millimole per liter may be associated with the gastric wall necrosis. So how is this possible? When you have the blood gas analyzer, collect the blood in the heparinized insulin syringe, you can check the lactate level. Then immediately you can start giving the treatment for that particular case. See, with just blood gas analysis, anemia, dehydration, hypoproteinemia, the electrolyte panel, potassium level you can check, blood glucose you can check, lactate level you can estimate. All those things you can quickly identify and correct the problem. At least it gives a life-saving work to that particular animals. So that's a very important machines. Commonly they use in most of the intensive care unit human medicine. With the right times, our practice with who is having the emergency critical care, better to have this. Even routine practice also better keep this ABG machine. Surgical management, a 50 to 80% rate of GDV recurrence is reported in medically managed cases. This already I told you. See, medically managed cases, suppose you are suspecting a GDV, you did the decompression and sending the case back, but there will be a recurrence. So therefore, GDV is considered a surgical emergency that has to be corrected. And once you don't correct the primary one, you keep getting this issue. Then it became a multi-organ death of the patient. Gastroplexy may not reduce the risk of gastric distension, but will reduce the risk of rotation and associated circulatory shock. You are taking the
Hatvet Pharma presents PantoHat, pantoprazole injection and tablets. A powerful tool to prevent and treat gastric ulcers and esophagitis. PantoHat is available in the following formats: pantoprazole sodium tablets, PantoHat 40 tablets, pantoprazole for injection, PantoHat IV injection. For placing order, contact our sales team or WhatsApp 98372 53817 or visit www.hatvet.com.
Stomach and after relieving all the gas and fixing it in the nearby wall, this will reduce the risk of rotation or the associated circulatory shock. Then gastropexy, nothing but taking the wall and taking the stomach, attaching with the wall. What they do know, curating in case of partial or chronic GDV, permanently adhering the stomach to the body wall in GDV, pyloric antrum the right body wall, easy and quick technique which reduces the recurring of GDV. Easy and quick technique, and it will avoid the recurrence. There are other types like tube gastropexy, circumcostal gastropexy, muscular flow flap gastropexy. These are all the other techniques they followed in managing case of GDV to avoid the recurrence. Now I will tell you about the tube gastropexy. Make a stab incision into the right abdominal wall, harder to the last rib, and the 4 to 10 cm lateral to the midline. The anatomic location they are telling. Place a Foley catheter through the stab incision. This already I told you. Tube means Foley's catheter. Gastropexy means attaching with the stomach. So there is a tube Foley catheter, and then the stomach you are fixing with the abdominal wall. So make a pursing suture with the 2-0 absorbable suture at a hypovolemic area on the ventral surface of the pyloric antrum. Create a stab incision in the pursing string and insert the Foley's catheter into it. Inflate the bulb of catheter with the saline and secure the pursing suture around the tubes. So you need to inflate with the saline and inflate the bulb of catheter with saline and secure the pursing suture around the tube. You need to put the pursing sutures. Pre-place the 3 or 4 absorbable suture between the pylorus and the body wall where tube exists. You need to have a, what I can say, pre-place 3 or 4 absorbable suture. You need to keep well in advance. Now draw the stomach through the traction of the catheter and tie the pre-placed sutures. Now you have to draw the stomach through the traction of catheters. Secure the tube to the skin. You have to secure the tube to the skin with the Roman sandal suture pattern. Then place a bandage around the abdomen and over the tube to prevent a premature removal. Leave the tube for 7 to 10 days, deflate and remove it. So now we kept the Foley's catheter into the stomach, attached with the right abdominal wall. The Foley catheter outside deep in the outside of the abdominal region. That is the outside of the abdominal region. So you need to leave the patient with this catheter for 7 days to avoid the recurrence, to avoid the bad gas forming in the stomach. Then deflate it and remove it. So even sometimes we put percutaneous endoscopic gas start in a tube that is having the mushroom cup. We fix it into the stomach. While removing, we won't put the suture on the stomach. What we did know, the mushroom cup in the stomach, it will collapse. Just like that, we take it out and then it will collapse. The stomach is having a good blood supply. The lot of contractile muscles, it will seal quickly. There won't be any seepage, there won't be any recurrence. So similarly, the Foley's catheter, whatever we kept 7 to 10 days before, you deflate, you can remove it, it will heal on its own. Provided it should have a good healthy tissues, good blood supply. If there is a necrosed part, you cannot attempt this type of procedures. This is the one they are telling, just making incisions and then the preformed sutures on the right abdominal wall. Now they are introducing the Foley's catheter. After introducing a Foley catheter, you need to along with the Foley's catheter stomach, you have to attach with the abdominal wall. This attachment you need to take the catheter, the Foley's catheter into the preformed suture site. You need to take it out. Then this Roman sandal suture pattern, you all know that you need to put it so that it will be with the patients. It cannot remove easily. This is the Roman sandal pattern. You can see the person sutures on the abdominal skin. The Roman sandal suture on the tube, so that it won't come out. That's the reason. You can see the site midventral incisions where they put, and then 4 to 10 centimeter lateral, they put a stab incision, and then we told you how we fix the Foley's catheter into stomach, how we need to inflate, and through this end, you need to inflate, and then it get fixed there, so that it can be with the patient for 7 to 10 days. Then after that, deflate and then remove it. You no need to open it. It get closer, and provided it should have a good healthy stomach, having good blood supply. Then circumcostal gastropexy. So you are attaching the stomach with the costal region, and now you can see in the image 1 inch seromuscular flap you are taking out, then 2 inch seromuscular flap you are taking it again, and then you are bringing it to the subcostal region, and then that flap area you are fixing in the the gastric antral flap, craniodorsal under the rib, and suture it to the original gastric margin or to the other flap. So once you fix it here, there won't be any recurrence. It get fixed with the costal region. Some amount of the flap of the stomach, they are fixing in the costal region. Muscular flap gastropexy. Muscular flap gastropexy. What they do, make an incision in the seromuscular layer of the gastric antrum and in the right ventrodorsal abdominal wall. Just make an incision. Suture the edge of the abdominal incision to the gastric incision using a simple continuous pattern. So you need to suture. Make sure the muscularis layer of the stomach is in contact with the abdominal wall muscles. So make sure that the muscular layer of the stomach is in contact with the abdominal wall muscles, so that it won't recur. It's another technique, muscular flap gastropexy. So this is a muscular flap. The previous thing is circumcostal gastropexy. Before I told you about the tube gastropexy. These are all attaching the stomach with the adjacent abdominal, right side of the abdominal wall, the various approaches. One through the tube, another tube with the muscle flap, another with the costal region muscle attachments. So the post-operative care and management is also very, very important. How the decompression is doing. Similarly, post-operative care and management is also important. And then electrolyte fluid acid base status to be monitored. Small amount of water, salt, and low fat food should be offered 12 to 24 hours after the surgery. And the patient observed for vomiting. If there any vomiting, we have to. If animal is vomiting severe, centrally acting antiemetic can be given. 1 0.1 to 0.2 mg per kg by IV or something. Secondary gastric ulcer may occur and treated with the H2 receptor antagonist. Use famotidine 2 mg per kg per orally or IV. Ventricular arrhythmia after 12 to 36 hours after surgery is common and it should be observed. Lidocaine, if it is not helping lidocaine, go for procainamide. Procainamide is also not helping, go for sotalol. These are all the ventricular arrhythmia management drugs. You can also read in the small emergency critical care book written by Deborah Silverstein. They were listed the dose when you need to start procainamide, when you need to use sotalol, and all those things, everything available there. Complications: sepsis, peritonitis due to gastric necrosis, disseminated intravascular coagulations, cardiac arrhythmia. These are all the result in death of the patient. A dick is formed in one of the major blood vessels. The blood supply to the particular organ getting minimized, and then it will lose the normal functions. Then necrosis is and then prognosis, timely surgery fair, gastric dilatation without volvulus better. If gastric necrosis poor, these are all the natural information about that. And another point, factor decreasing risk of the bloat. So, another way, inclusion of canned dog food in the diet, inclusion of table scrap in the diet. Happy or easygoing temperament should not be stressed too much. Feeding a dry food containing a calcium-rich meat meal, such as meat or lamb meal, fish meal, chicken byproduct meal, meat meal, or bone meal, listed in the beginning of my presentations. Eating 2 or more meals per day is advisable. These are all some of the recommendations in managing a case of GDV. Some of the take-home points in case of management of GDV. So whenever you get a GDV cases, your team should be trained. They should understand the problems, the seriousness of the cases. Even I will say you have to train your staff in the reception itself. That is, we call this telephonic triage. Why we are advised you to do a telephonic triage? In the history itself, when the your receptionist is talking to the pet parent itself, you can grasp observations and some of the history. The most important thing is breed. If they are telling grade A, vomiting, restless, stomach distended, then there itself your receptionist understand there is a GDV problems. The another thing, other she can intimate. You will have to tell them the animal should not be disturbed. They should bring it, without any disturbance. She can advise, ask her to go to the nearby place for gastric decompression, or for evaluation. What could be the reasons? Once they are done, they can bring it to the major hospital, wherein they must have a gas anesthesia. The trained medical team should be available in case of ventricular premature complex or ventricular tachycardia. These are the common problems we can include in management of GDV. And then the internal medicine should be aware of using doing electrolyte panels, all blood gas parameters. And based on the assessment, the internal medicine should correct the underlying cause. How the GDV surgery is important. Equally, the management of the cases also very important. Once you do a surgery, put an incision on the stomach, relieve all the gas, and fixing with the right abdominal wall, and fixing the Foley's catheter, or doing the various technique which we told in the past, attaching with the abdominal wall, attaching to the costal muscles. These are the various techniques wherein we can avoid the relapse of GDV. But equal to the surgery, the medical management is important. Like hypothermia, you need to correct the hypothermia. Hypoglycemia, you need to correct the hypoglycemia by giving the blood glucose. I already told you 20% dose, 1 ml every 1 day. So hypothermia means you should not treat the animal in the air conditioned room. You must take it to the warm room, and you must have a warmer. You can correct the patient with the warmer. The bed also should be warm, and you can cover the patient with the warmer also. The periodical evaluation of temperature is very important. I told you, because of the compression, animal have a tachycardia. Supply less amount of blood to the vital organ. Take the heart rate is very important. If we exceed more than the normal limit, we need to address, and we need to bring the heart rate within the normal limit. And another thing, if the animal is dehydrated, you have to give the fluid, and then fix the two Ventolin, cephalic, and subcutaneous. Give a more amount of fluid administrations. Animal is anemic, give a blood. You must have the blood bank in your hospital. Animal is anemic because of severe distension. It causes necrosis of the spleen, too much of blood loss. There is anemia. If you don't address this problem, the animal will die. So you need to correct the anemia problem by giving the blood. There are CPDA blood bag available. So 10 ml every kilo body weight you can infuse. Initially 5 to 10 minutes you have to give slowly. After that you can increase the speed. First transmission is always safe in case of dog. Second transmission you have to go for cross matching. Even nowadays a lot of article insisting the you have to do the major and minor match, then you can go over. The dog erythrocyte 1.1 negative blood group is very safer. And we observed, in our place, Tamil Nadu, there is a breed called City Park. They have a less amount of 1.1 negative group. So I keep them 4 or 5 dogs in my hospital and shelter. So periodically I deworm them. Periodically I give them all the vaccination, December, Parvo, Lepto, rabies, and then spot on. So these are all the major culprits in dogs. So once you prevent that, I'll also collect the blood sample every 3 months, HB, BCG, RBC check. And then we'll also check any vector-borne disease by doing PCR. If everything is normal, no, any emergency case comes, so my donor dog is ready. We collect the blood, and then we infuse them. We found a better success rate. The more we delay in the management, the more the mortality. Till date, a lot of mortality encountered in all over the world. So that means we need to correct the problems, whatever you are facing. Then hypokalemia, I told you, we have to add a potassium into the saline and then correct the problem. And then the lactates, that's because of the septic condition, the lactate level getting elevated. Even dehydration, if you're correcting, the 40% of the survival rate they observe. So that's it. Then your team should be trained in putting a vascular access. The more you delay in the vascular access, you try a cut down technique and save the area, raise the blood vessels, cephalic circulation, fix the catheter. It should be done in quick, or within a minute or two. The more we delay, more is the mortality. That has to be done. Then another important message, VPC, I told you, we have to do the lignocaine. Lignocaine is not helping. You can use propionamide. Propionamide is not helping. You can use sotalol. There are a lot of detailed drug handling given in the Dabaras Western Critical Care Book Medicine. This already I told you. Then the telephonic triage over means the team should be ready. Team should be ready means oxygen should be, gas anesthesia machine should be ready, warmer should be ready, all the IV fluid should be ready, then antibiotics should be ready, and your team should be available, trained team, surgeon, internal medicine man, anesthetist, trained technicians, they should be available. All the functional machines should be available in the unit. So the person who is the owner or who is running the hospital, you must check the theater every day. See that all the materials that are available on time, and nighttime cleaning, nighttime keeping the material ready for the next day requirement is very, very important, rather than planning the day of surgery. So you must keep the staff on rotation so that your paramedical people keep your instrument and all accessories for your procedure, all catheters, blood collection tubes, your BP, Doppler BP machines. The most important is, suppose suddenly BP falls, you need to correct hypovolemic shock, give the fluid, the BP will come up. So like that, these are all the some of the guidelines available in the management of GDV, and the pet parent should be educated as well as the telephone trials and referring to the then. Similarly, your staff should be available on rotation every 8 hours. Doctor, nurse, technicians, attendant should be available on rotations. So then only you can equally take care of the post-operative care also. The majority of the cases after the surgery they send it to us, and then for the management, especially the VPC and the electrolyte abnormalities and all those things. If you don't correct these problems, the animal will develop into various complications, and then that we have to address. And then the lignocaine also should not be exceeded more than the normal recommendations. If it exceed, that result in lignocaine toxicity, that will also cause a lot of mortality. Periodical evaluation of lignocaine level in the animal blood also is very important. All other organ function assessment is very important, and then maybe check if you are doing a tube taxi, check whether the tube infection. Sometime you get occluded with the mucus and other things. You need to infuse saline and dislodge the tubes, obstructed material, so that you not have any problems. These are all nutshell information about the GDV and its management. And we'll meet you in much more detail in the next topic.
For placing order, contact our sales team, WhatsApp at 98372 53817 or visit www.hatvet.com. Thank you.